Good afternoon, and welcome to Data Governance Best Practices to Keep Your Quality High and Users Empowered, a Health System CIO Media Inc. production sponsored by ELLKAY. Just a little housekeeping before we get started. My name's Anthony Goriah. I'm the Editor-in-Chief of Health System CIO, and I will be your moderator today. We have a few interactive features we'd like you to know about. One is a poll called Agree or Over the Top, where we put out some statements, and we look to see what you think about them. So the polling panel will automatically open when we launch that poll. Also, questions and comments we would like you to send in both as they occur to you. Leave the default set to all panelists, and we will take those later in the program. And you can also download the deck using the URL on your screen, and it's at the bottom of our slides, and it's been sent out in the chat box. Just so you see how we're going to spend our time today, first we're going to go about 35 to 40 minutes with our featured panel discussion with Dr. Zafar Chaudry, SVP and CIO at Seattle Children's, Stephen Goriah, VP of IT, CIO, and CISO with the Westchester Medical Center, and Kamal Patel, CIO at ELLKAY. So without any further delay, we are going to jump right into our conversation. Zafar, let's start with you. Can you give us an overview of your organization and your role?
So, good morning, good afternoon, everyone. Seattle Children's is a pediatric health system. We cover 4 states, Washington, Montana, Alaska, and Idaho. We're a $2.4 billion pediatric health system with about 11,000 people.
All right, very good. Thank you, Zafar. Stephen?
Anthony, thank you for inviting me to the call, and hello, everyone. WMC Health is a compilation of 10 hospitals and about 75 physician practices in Westchester County, northern Westchester, led by the Westchester Medical Center, which is a quaternary care facility, 650 beds, located in Valhalla.
All right, Stephen, thank you. Kamal?
Hi, good morning and good afternoon, everyone. I'm the CIO of ELLKAY. ELLKAY provides solutions in 5 segments of healthcare. We partner with nation's leading hospitals and health systems. We partner with practices, EHR vendors, lab market, and the payer market. For the health systems, we are the trusted source of data connectivity. For the payers, we have a value-based care platform. And we have archived and managed about 160 million unique patient lives today. And from a connectivity standpoint, we are connected to about close to 50,000 practices with 400-plus labs and 200-plus hospitals.
All right, very good. All right, let's get into it. Stephen, let's start with you. How would you describe your data governance philosophy or approach?
My philosophy is quite simple. Looking at data governance, we first have to assess where we are and try to implement some sort of model that fits our organization. So not one model fits all. You have to assess your culture, your organization appetite for risk, and where your data are, and then work with senior leadership in implementing the correct approach. Currently at Westchester, we're in the infantry stages of getting a data governance model implemented. We're looking at various different models to see which one fits us right, but with every model, you have to have a few things that are appropriate. You have to look at best practices, see how best practices fit into your organization, making sure within the best practices that you have senior leadership support, you have making sure that the best practices are applied, having dedicated resources, and defining core concepts and data governance processes that fits the culture within your organization. Within that, also, you have to make sure that you have the roles and responsibilities clearly defined at an executive level, strategic level, tactical, and operational level. Again, you have to focus on communications. I've heard that some folks say that communication really accounts for 80% of data governance. And again, having all that in place, you have to have an action plan. How do we implement the appropriate governance? You could have invasive versus non-invasive governance, but again, you have to see what's right for your organization and what's right for the culture of your organization. So my approach is somewhat democratic, inclusive, want it to be non-invasive and make sure our data is protected, and the risk associated with not having a data governance is addressed, and we'll make sure that risk is quantified and communicated to the leaders, so we have organization support and how we're addressing it, and making sure that the punitive or disciplinary actions that are required to get compliance across the organization is supported from the highest level.
Very good. Thank you, Stephen. Kamal, as a vendor, do you have a philosophy on the type of vendor you want to be, or does the same thing apply to what Stephen was saying about his organization having a approach or philosophy? What's your philosophy?
So when we are working, with health systems, we wanted to have an environment where our team and our processes are aligned with the health system. So we start with compliance, for their policies and procedures, and then security, and then on the technology side, it's primarily around the quality of data. So education and training across all the various teams that are working. So as a vendor, do all these various teams align with our customers' requirements, with their quality guidelines, with their security guidelines, with the HIM requirements. So we, as a vendor, we are thinking from those standpoints and align with that. And from a compliance standpoint, we hired the person who runs our compliance is from who used to run compliance at a large health system. So this allows our customers to see and understand, where they're coming from, but to make sure that, first is the belief that we can actually help them out, and second is what kind of adjustments, can a vendor make to accommodate, the requirements that health systems would have.
Very good. Zafar?
So Seattle Children's, we believe that strong data governance ensures that the right information of the right quality is available to the right person for the right purpose at the right time. And so we break data governance down into 4 components. First component being data stewardship, who has accountability for those data assets and who manages those data assets. Then the actual ownership of the data, who is the subject matter expert around that data. We then combine that with data policy, so these are the rules that we use to manage the data assets. And then we try to create a set of data standards, which then takes us through a journey. So I think when you start this journey in data governance means different things to different individuals. And we've taken the approach of the business priorities should drive that data governance. And we started our journey with the greatest areas of need that we had to then form this data governance council. We also have to be mindful of the legislative requirements and any enhanced data processes and reporting needs in our organization. We then sort of take our IT strategy and make sure that aligns with the data governance policies and council that we've created. But I think there's a big challenge in terms of shifting the culture in an organization towards this data governance type model, and that's what we found is taking time. So we're working through that.
Very good. Thank you for that. All right, next question. Zafar, let's stick with you on this. What's the mechanism for establishing data governance procedures at your health system? How do you ensure the latest regulatory and legal requirements are met? And do some organizations go beyond legal requirements? We hear often in a number of areas that don't just come up with procedures and don't just work to satisfy the letter of the law, but in most cases it's best business practice to go beyond. So what are your thoughts around that?
So I think you first have to determine within your organization who the stakeholders are going to be, which is what we've done. So this isn't an IT-led project. This has to include operations. This has to include the clinical departments. And that is where you start to establish this data governance mechanism. Once you've done that, you'd partner with legal to make sure that you know exactly what those regulatory and legal requirements are for the region that you're in, which is what we've been doing. And then once you have that, it is the Data Governance Council that has these multi-stakeholders that guides the journey as to how you're going to store, protect, take care, clean, and store your data for the long term.
Mm-hmm. All right, very good. Stephen, your thoughts on the question?
Great question, great answer, Zafar. I agree that engaging compliance, legal, and especially security, since we're HITRUST certified, HITRUST has guidelines that govern how our data should be protected as well, but make it a collaborative approach with compliance and legal, so you can present to the data security committees, various different committees you have, but the steering committee in making sure you're abiding by various different guidelines. But again, you have to be able to implement it at a level that is effective. Having everything thrown at the kitchen sink may not necessarily work. So you really have to make sure you're compliant, but yet apply it in a way that it works for your organization.
Very good. All right, next question. Kamal, let's start with you. What is the cause of bad data, and how can it be reduced? How does solid data governance help?
So I think it starts with, Zafar said it nicely, okay, that, organizations have lack of processes around the ownership and stewardship of data, and it starts from there. And then there are things such as, what we come across is processes within each health systems are different, where some health systems may allow their providers to have either delayed updating of patient charts. Okay, so that has some level of impact. We notice that there is loss of data occurring there, but primarily around bad integrations. So things that are happening behind the scenes, okay, which don't have any visibility, and these interfaces have the ability to update the underlying systems. And I think a lot of it can be resolved with the proper training, which I feel like not a whole lot of time is being spent on. So the ownership, the teams, if they take the responsibilities around also going out to all the various departments, okay, and training them around the importance of the quality around data, that's an important angle. The last thing I want to add here is education. The shifts that are happening in reimbursements, where the risks are now shared between payers and provider organizations for the health systems getting paid, it is important for, I believe, the reporting has to be accurate, because now the reporting drives reimbursements. And I believe that data ownership, storage, quality of data, and whether the underlying data structures actually support these new shifts towards reimbursements, okay, are supported. But I believe that education is an important piece where it needs to be transitioned across all these various teams within the healthcare organization.
Very good. Thank you, Stephen.
My feelings on bad data really relies on not having the appropriate data governance process in place. And many people are at different stages with their data governance processes. So making sure as you initially get into the process to understand who has access to the data, and making sure that everyone becomes a data steward. Everyone has to feel engaged, empowered, and understand the risk of not being in compliance with the data governance standards. So it's a matter of communication. It's a matter of engagement. It's a matter of them knowing the risk associated with not complying or following or engaging with the data management processes and structure that are in place. So yes, it's not the lack of a data governance process, but I feel mostly it's getting to know where your data resides, who's touching your data, and making sure that it's the appropriate people, and whoever that is, making sure that they're completely engaged in the process and realizing the consequences of not being engaged.
Very good. Zafar?
I agree with Stephen. I think there's a certain number of areas to look at when you're trying to avoid the bad data situation. One we've talked about, which is the data governance team structure with multiple stakeholders. I think having the right roles and responsibilities, who are the subject matter experts, change in culture and good communication around data and how it should be managed. There should be data asset management itself. What are the enabling processes? So you have to embed these data governance processes into all of your projects and the project pipelines. Organizations aren't good at definition and standards around data, and those should be defined. Then we need to look at data quality management, ensuring that there's enough data governance representation around the organization. People should use metrics and monitoring around the quality of data, and that should be reported back to clinical staff so that they know that they are either getting it right or not getting it right, and then there are different types of tools and technology to layer on top of that.
Very good. All right, let's stick with you, Zafar. Address each of these items that commonly contribute to a hard-to-navigate data environment. Data housed across multiple reporting tools and warehouses, data insufficiently labeled, and data that is not searchable.
Yeah, so the interesting thing about data and how we manage it in healthcare is we tend to have it sprawled all over the place. So recently, if you look at the number of systems that someone has, we at Children's have about 755 systems, all of which are storing some form of data in a different type of database. And over time, you see strategies in healthcare organizations where people try to centralize that data. So the concept of the enterprise data warehouse is quite common now. And then once you pull the data into that singular system, you then find that you have data quality issues because bad data in gives you bad data out, right? And so I always link that to saying, well, most organizations are struggling with the training of their people. If you don't train people on how to enter data correctly, then they're not going to enter it correctly. And physicians, nurses, they do love their free text areas within systems. Mm-hmm. Because it's just quicker to enter data that way. But with a free text model, you get typographical errors, you get a whole kinds of issues, which will then lead to not having the data sufficiently labeled. And if the data is in free text, it's harder to search because there's no standardization of it.
And reports, right? Hard to produce reports, things like that.
Yes, so the report quality would then vary at that point.
Mm-hmm. Right. Kamal?
I agree with Zafar on all the points. I think the free text, and we are seeing that when information entered as free text, especially in smaller EHRs, not so much on the hospital side. What we tend to see is that any of these new reporting guidelines that are coming out, information such as is a person smoking or not smoking, if it's not stored in an appropriate field and it's written as free text, it's not reportable, and that would have impact around the revenue models, but as well as around any clinic, like if you want to go back to the patient chart, or if to identify previous information that comes into play. The one thing I want to add is when health systems are doing integrations, taking, assuming that, hey, these are legacy systems, let us just move into PDFs, and link it back to the patient chart. Those things, they come into play later on where, hey, we shouldn't have done PDFs, we should have kept whatever information is available discreetly. So there needs to be a balance between the data governance teams and the teams that are doing cost efficiency around retiring legacy systems. And that balance may vary across different health systems, but that having that communication and conversation, I think, is important.
Kamal, I think that's great, and since we're going through a transition process right now with replacing our EMR and working with you and your team at ELLKAY in archiving our various different systems and having a team such as yours who are very versed and aligned with our data governance process, we're seeing many, many areas where, the discrete data is not available, the data was not correct, but having a partner like ELLKAY that has processes built in are helping us to identify that, and the ability of ELLKAY's tool to really integrate discrete data and to clean the data up. So at the end of, where we are, data will be all housed in one archive. And I have to commend Kamal and his team for having that process built into their system. That's really been a blessing to have them work with us in this process. So I just want to throw that in, and thank you, Kamal.
Absolutely. Thank you.
All right, very good. Next question. What level of technical skill among users should be assumed when evaluating data extraction interfaces? How are you working to make it easier for users to get the information they want? So you have two different schools of thought here, depending on what we're talking about, right? For a major EHR, everybody assumes you're going to need training. You're not just going to get to walk in and figure out how to use the tool. For an iPhone, for example, the whole concept is you don't even need a manual. What is the thinking when we talk about physicians and nurses being able to extract data that they want and run reports? How complicated should it be to do that? Should they need a data steward by their side, or should they have to put in a request, or should it be self-serve? So, Kamal, let me start with you.
So I think the whole idea about having a formal governance is to make this self-serve, right? So you don't want people to actually, if you have if you're doing all the things right around ownership, okay, and governing the pieces, okay, and quality, okay, and compliance and processes, people should be able to just do their jobs without worrying about it. I think the places where data is entered, training is important, and what we do, and like we are coming from a vendor standpoint, so we talk to the health systems HIM departments. Okay, we talk to their compliance team and understand security concerns. We educate them about any changes, okay, in market. Okay, what we are seeing in terms of if our customers tell us that, hey, we just want to do this, we share with them saying by doing this, okay, at the current point, these are the areas where you're going to impact. Some of the health systems have understanding of the master patient index, okay, and the importance of that, because the direction where everybody is going towards, I feel, or what we are seeing in terms of the trend is having a longitudinal view around the patients, okay, both from the outpatients as well as inpatient, and also then reaching out to the Commonwealth care quality and bringing those data in. So I feel like, there are all these various silos, okay, and if the health system has aligned with all these various people or various departments within the organization, it kind of helps in putting together a great execution plan around governance.
Very good. Stephen?
Having everyone engage in the process and understand that their roles, that they have the relationship with the data, and that they understand the risk associated with the data quality, and being able to follow those guidelines and processes that are established by the Data Governance Committee, assuming you have a really well-functioning Data Governance Committee, would make it easier to have the ability to extract data spread widely across the organization. And knowing that you're only allowed, or whatever guidelines you're allowed to follow, would help in your ability to extract, but not just extract the right data and make sure the right message is communicated to the end users. Because if you're not, the message or the data is provided can be misleading if not everybody's engaged in the same processes and following the same guidelines. Again, technology, these days with the new EMRs, it's really not that difficult. I don't think the skill set, with some training, their ability to extract the data shouldn't be a problem, but I think having everyone engaged in the same processes and understanding risk associated with not following the data governance guidelines would be most effective in getting the right information to the right person and make sure that it's the correct information as well.
Very good. Zafar?
I think everybody wants to evolve to a self-service all-you-can-eat data environment. I think that's an evolutionary process in healthcare because a lot of the systems we use are built on antiquated code. They're not the latest and greatest of systems, and I agree the HRs are getting better at allowing physicians and nurses to consume that data, but without having the context of what that data really means to them, you then run into this challenge that we've had around reporting. So in my environment, if I produce a report for a physician and hand it to the physician and the report is read, it tends to get challenged and say the data is wrong. So the approach we take with this is, yes, we want our physicians and nurses to get to self-service, but we also align data analysts to those physicians and nurses to help them understand the data that has been produced in the reports that they ask for or they consume. And then over a journey of time, they become a lot more comfortable with that consumption of data themselves.
Very good. All right, Stephen, let's start with you here. What are some other common errors organizations may be making in their data environments? Anything come to mind?
Absolutely. Looking at multiple organizations, and when they try to implement a data governance process, they may implement the good data governance process as they think that's the best thing to do, but not looking at your organization culture and how adaptable that would be or what value that process can bring to your organization is critical. So if an organization was to implement some sort of best practices or processes that they felt was adequate and not looking at the impact to its culture and organization and that it would actually be implemented or it's doable within that organization, I think it's highly risky for someone to, push forward something that wouldn't, not just for the sake of pushing it forward, but it has to work. It has to be adaptable to the culture, and it has to add value to that organization as well.
Very good. Zafar?
I think two things. First of all, establishing a collaborative process to support the ongoing management and oversight of your data dictionaries and business rules, as well as appropriate usage guidelines for data sources using industry standards is a gap that I see. And the other is around metrics and monitoring. I think there should be more automation around data quality monitoring and detection by aligning with statistically driven detection methods and maybe implementing standardized reporting with real-time dashboards. That would then help measure data quality and improve some of this real-time clinical decision support that people are looking for from the data in this consumption model.
Very good. Kamal?
The one thing I would add is, for health systems to understand that this is like when it comes to data governance, the value of doing it correctly takes time. And a lot of what we end up seeing in the market is, hey, we tried it for 18 months, okay, and we don't need these many resources, okay, working on these things, okay, so now we should take a step back, okay, and cut costs. Or sometimes they're doing the reverse, which is instead of investing in in-house people who work with the various departments, okay, they're going out, okay, and bringing in consulting teams where the cost becomes very visible to the, to the CIOs, okay, or to the compliance teams, okay, who's to whom they are reporting around this. So having that patience and having a good, clear vision and strategy around it is an important piece. Even if it is small, okay, that is going out, okay, in terms of having the right people, okay, who can invest in the education and the importance of the quality of data across organization. So to be focused, okay, using the right way.
All right, very good. We've got our fun feature here, agree or over the top. 3 statements here I'd like you all to respond. The poll module should have opened on the right-hand side. So when it comes to these statements, do you agree or do you think they're over the top? First statement, most hospital data pulled together for reports is bad. So there's a bold statement. IT should lead data governance efforts. There's another statement. Agree or over the top. And doctors are sloppy about entering data because they resent having to enter it at all. They don't even want to be doing it. So that's what I do with laundry at home. I'm bad at it because I don't want to do it. And then sometimes I get out of it. So is that what's going on here? So take a moment and answer those questions. We'll give you about a minute or 2 there, and then we will come back and look at the results. But while we're doing that, we're going to move to our Ask a Co-Panelist question, one of my favorite features. And I'd like Kamal to go first. Kamal, do you have a question for one or both of your co-panelists?
Sure. I'll ask Zafar. Zafar, are there any initiatives that Seattle Children's is planning over the next 18 months related to data governance?
Yeah, so we've started our journey, and we started the journey by looking at our people and process. I think from a technology standpoint, we know where our data is and we know where it's centralized in our data warehouse, but what we don't have a good handle on is what are the roles and responsibilities and who needs to be involved in this data governance council type structure, and then wrap the processes around that for how do we do data asset management and how do we define our new standards for data.
Okay, Kamal, anything for Stephen?
No, I mean, I've been asking Stephen a lot of questions, so I'm good.
I got it. All right, Zafar, any questions for your co-panelist?
So my question, and this could apply to both of my co-panelists, is, so how do we actually measure the maturity of our data governance? Is there any standards out there or measurement models that we could use?
All right, Stephen, you want to go first?
Yeah, I'll take that. There are various models out there that you can really measure what you have and define processes. For example, you can measure against them to make sure, do you have executive support? Do you have the appropriate committees established and are running? Are the committees running appropriately? There are guidelines out there that will tell you, for an appropriate, high-level, well-functioning data management, data governance process, these are the things, basic processes you should have. So I heard you said earlier that you do not have a well-functioning data governance committee and all the subcommittees that are required to run this, making sure that, those committees are function well. Do you have well-defined processes? Do you measure that against some sort of standards? Do you have the dedicated resources for that? So there are various different things you can measure against well-established organizations and best practices. And then after you measure that, look at the gap and see how you can implement that. But absolutely, there are various different models out there that you choose which one's right for your organization and apply those governance principles against what you have and see where you are, and then look at the gaps and how can you effectively apply strategies to overcome those gaps.
Very good. Kamal?
Yeah. So, and Stephen showed the pathway of what you can do. Okay, so I'm going to give a slightly different perspective. So even though the end result is harder, so what are the end results, okay, that we want to accomplish? Okay, so having the right data available at the point of care. okay, regardless of if a patient gets admitted into a health system and it's getting registered for the first time, okay, do you have data, okay, from other health systems, okay, who are partnered with this health system and around the region at the time of point of care? And do you have the data available from ambulatory locations who are using a different system? So that is an end result, what you could achieve for one use case, which is having the data accessible at point of care. The second one is around reimbursements models. So when the revenue teams in the health systems are driving it, okay, is the data stored in a way where we can, where the health system can align with the revenue models in the industry so they can continue to get paid for the services, okay, that they are performing effectively. And the third and fourth use case are more around analytics, where one is around reporting and quality for all the different departments to do their different responsibilities or have run through their responsibilities effectively. And the last one around analytics is around predictive, where research teams, okay, or can we identify disease states, okay, or perform research, okay, earlier, okay, for at a patient level, okay, and identify some of these things using data that exists in the system. So now, depending on which use cases are important, okay, within these health organizations, they can drive certain pieces through certain departments, okay, and build a strategy around what is more important to them. And Zafar, for an organization like yours, okay, probably all four may be at play. But I think, for people who are starting out, okay, looking at the end result, okay, and then building a plan may help using what Steve recommended.
Thank you.
Very good. Stephen, question for your co-panelists.
I'll address this one to Zafar because Kamal didn't want to ask me any questions earlier. I'm kidding.
Oh, yeah, revenge.
Zafar.
I like that.
Revenge, absolutely. So, Zafar, what do you see as the greatest challenge for you really moving your data governance process forward? I heard you said earlier, as we mentioned, you don't have those committees and all those other things established yet, even though you have a great data warehouse and maybe a great data analytics strategy established. What are you seeing as the greatest obstacles in your way? Is it executive backing? What user engagement? Where are you?
So I think we have executive backing. The biggest challenge I see in my organization is competing priorities. Because what we're finding is we're doing so many different types of project, and we, as well as yourselves, we're doing a Cerner to Epic migration as a big project, and then we'll be doing an ERP replacement. So what you tend to find is the same people get nominated for the multiple committees. And so finding the time to get everybody around the table multiple times for 5 different areas is where people are now pushing back and saying, we don't have the bandwidth. So we're going to have to decide strategically which portion of our strategy moving forwards do we want to bite off. So people just can't do, it's that concept of do 10 things well versus 100 things badly. And so that's the pushback we're getting, is to say, well, you now want to do the data governance thing, but we still have the EHR stuff to do, and we have the ERP stuff to do, and we just finished a big data center migration. So people are tired of being dragged into so many different things while still having to do their day job.
Mm-hmm.
Completely agree. I feel like we're living parallel lives.
Yeah. Yeah.
All right, very good. All right, well, we have got our poll results that I am going to share with the audience now. You should be able to see those. So we're going to go through those and get reaction from our panelists. So to the first point I'd like to hear from Stephen. Most hospital data pulled together for reports is bad. So the responses were 38% agreed with that statement. 57% say it's over the top. So what are your thoughts on,
I would agree.
Do you agree or go ahead?
I would agree with the poll. I think it's a little over the top. There have been many initiatives to make sure that with all the inventive, meaningful use and the new EMR coming in place, the data is better. It's not perfect, but I think the statement of all data is bad and the majority of data is bad is a little over the top.
All right. Well done. Well done. Next one is going to go for Kamal. IT should lead data governance efforts, and the responses there were 71% agree with that statement, but 24% think that's over the top. So your thoughts?
So we're having a panel, okay, of all CIOs, okay, and so my opinion is going to be biased. So I would choose, okay, that IT should be the leading data governance, okay, but I am pretty sure that if we talk to a CMO, okay, or if we talk to our chief compliance officer, they may think otherwise. So I'm going to go neutral on this.
Well, you can't. That's not fair. That's not fair. I love it.
IT.
Okay. Very good.
How about we give him this? Let IT lead it, but have a business executive, be the champion or sponsor of it, so you have the best of both worlds.
Completely
All
agree.
right. Very. Okay. All right. Go ahead. Let's hear from you, Zafar.
No, I completely agree with that. I think.
Oh, you agree? Okay.
I think IT should have a pivotal role, but it should still be having the right level of sponsorship from an executive perspective.
All right, very good. All right, we're going to stick with you, Zafar, for the last one, as you are a physician. Doctors are sloppy about entering data because they resent having to enter it at all. Interesting results here. 48% agree, 48% think it's over the top. So evenly split. What do you think?
So it's an absolute dead heat there. I think.
Yeah.
I'm still going to go with it's over the top, and I say that because there is a lot of discussion at clinical level now around burnout. So the more we're asking physicians to enter information into systems, the more unhappy they become because that's taking time away from patient-facing work, and that's what you tend to get into medicine for. In terms of the sloppiness component, well, I think the quality of data that goes into a system is directly related to how much and the quality of training you give an individual.
Mm-hmm.
So, if you do not train people, remember, physicians evolve from this world of I write my notes in a paper chart, and then they evolve into this technology domain space. So if you're not training them as to how the information should be entered so that it can be mined, then you're going to get that same level of quick entry, which then can be defined as sloppy. So I think it's a combination of training and it's a combination of burnout where people actually want to spend more time with the patient versus typing in, or clicking in multiple fields. Nobody wants to do 17 clicks to get through one cycle while seeing a patient.
Yep. All right, very good. Audience, want to remind our audience that if you have any questions or comments, send them in the Q&A box. We have a few minutes for questions. First audience question, what tools are you using to evaluate quality of data? Stephen?
We have various tools in place. We have various different analytic tools. We are engaging with Health Catalyst with their tool and their ETL processes. We work with vendors such as ELLKAY that have a defined processes. Yes, we have the tool, but you have the processes that go along with the tools as well. So we work with multiple tools, but the tools without the processes and the appropriate governance would not be as effective. So the tool by itself would probably be useless at this time.
Zafar, anything you want to comment on there?
Yeah, same for us. We use a combination of tools after putting everything into a warehouse, how we report, how we measure. So it's a combination. We use a combination of Tableau, Power BI, Click. Just depends what you're trying to achieve with that data.
All right, very good. All right, this is an interesting question. Kamal, let me go with you on this one. Do you have any sort of anything you would challenge the listeners on the call to go back when they go back to work today, when they get off the webinar? What's your challenge to them that'll help them improve what the processes we're talking about today. Something simple, something they could start with, a good starting point.
Okay, so the two areas, like the two easy areas to begin with, which I feel would also end up having a great value, would be identify systems that are vulnerable. So if they have legacy things, okay, that came from acquisitions, okay, or transition of a system, once you identify the vulnerabilities, okay, you know that, hey, we need to find or at least have some sort of a roadmap, okay, to reduce that risk. And the other area is identify areas where either within the EHRs where information is going in as PDFs or information is going in as free type things. Now, PDFs are fine unless there is discrete data, like let us say a lab result is coming in as a discrete value and is getting turned into a PDF, and that's getting stored. The value of that stored data may help the patient during the point of care for that incident, but then that data almost becomes non-usable for reporting. So if they identify these areas, then it's going to help them improve the quality of the data, and sometime, or at least even if it's identified, they can go back and make it a priority at some point in the future.
Very good. Stephen?
So a couple of things. First is understanding who has access to your data and who's doing what with your data. If that's documented, that's a great starting point. Again, everyone is engaged. Everyone becomes a data steward. And don't assign responsibility, really ask them to be part of the team, engaging with the data owners and making sure they're following your processes. And again, data governance, you don't have to create data governance processes. Just apply data governance to establish processes. So, for example, if you have a process you feel that's really, really good, your ETL process that's really good and you're comfortable with it, just apply data governance principles to those processes.
Very good. Zafar?
I think I would challenge listeners to go back and look at how mature they are in this space by reviewing certain areas, such as their org structure around this, who is responsible, what are the roles around data, how they communicate what's happening in the data space with their stakeholders, how do they manage their assets, how do they enable their processes, what standards are they following, and what metrics are they putting in place.
All right, excellent. Well, that is about all we had time for today. Great conversation, great panelists. Regarding continuing education, those of you who hold the CHIME CIO certification get 1 CEU for attending our webinars. We will let CHIME know you were here if you've asked us to. Otherwise, make sure you tell them. If you need a certificate of attendance for a different CEU program, you can use the final slide in this deck. You'll get an email when the on-demand recording of this event is ready. And if you'd like to sponsor an upcoming event or book a custom event, you can visit our website or contact Nancy Wilcox, and you can go to our website to register for our upcoming webinars. I want to thank our panel, Dr. Zafar Chaudry, Stephen Goriah, and Kamal Patel very much, and I want to thank ELLKAY for sponsoring this important conversation. I want to thank you for attending. And with that, everybody have a wonderful day. Thank you.